Hello, everybody. We are welcome to our webinar today. We're going to give it a minute while other folks join our webinar. Looks like people are starting to join. We'll give another 30 seconds. Hello, everybody. We're just waiting for folks to join so we can start. Great, let's get started. Welcome, everyone, and thank you for joining us today on our webinar with our partner, Stitch PEO. And our topic today is Time is Money, how to streamline your practice's HR with a PEO. Before we start today, I'd like to throw out a couple of housekeeping items. We will definitely be monitoring questions and welcome any questions that you may have. Please feel free to type them into the Q&A chat throughout the session. If we run out of time, we will follow up and answer the questions after the webinar. I'd like to introduce our speakers for today's webinar from Stitch. We have Hamza Ayub. He is the Director of Healthcare and PEO Sales. Welcome, Hamza. Hamza is a technology enthusiast and he's a seasoned sales professional, passionate about using technology to drive innovation, particularly in the healthcare sector. He began his career as a clinical healthcare worker, providing hands-on patient care and gaining invaluable insights into the nuances of the healthcare system. This foundation is what's fueled his commitment to improving patient outcomes and healthcare delivery. We also have Jason Ersoff. He's the head of client experience and HR at SEO. Jason is a workforce management and human resources leader and an expert in providing solutions and creating process improvements. He has consulted with thousands of clients from very small businesses to Fortune 1000. I'm pleased to turn it over to Hamza and Jason for the rest of the presentation. Welcome, gentlemen.
Thank you.
Thank you. Let me go ahead and pop up my screen. All right, guys, on behalf of Stitch and Unislink, I would like to thank you all for joining us today for the Time is Money webinar, streamlining your practice's HR with a PEO. As Gina mentioned, my name, my name is Hamza Ayub. I am the Director of Sales here in California for Stitch PEO. I'll pass it over to Jason for a quick little introduction.
Hello, everybody. My name is Jason Ersoff. I am the Director of Client Experience, which is our customer success and our HR here at Stitch PEO as well. Thank you.
Quick little agenda for today's webinar. We'll start off with discussing what a PEO is, along with the 5 W's. We'll dive a little bit into cost reduction. I'll pass it off to Jason, and he'll go over how a PEO is saving organizations time, how a PEO can help enhance employee experience and employee satisfaction, and the support a PEO can provide when it comes to risk and compliance. So, the 5 W's of a PEO. Number 1, what is a PEO? A PEO, also known as a professional employer organization, is almost like having an HR team for your organization that handles all the administrative employment tasks. Think everything from payroll administration to benefits to HR to compliance, workers' compensation. In healthcare, this really allows you to do what you do best as a practice, which is take care of your patients while you have this team behind your team that's focusing on, providing you better resources, providing you better benefits, handling all these nitty-gritty compliance tasks and payroll tasks on a day-to-day basis. You may be wondering who we are, why we're talking about HR, why we're telling you about healthcare practices. Stitch is actually a very unique, first-of-its-kind PEO, or the first-of-its-kind practice workforce solution built specifically for independent healthcare practices. Stitch's goal is to allow independent healthcare practices access to the right HR, payroll, benefit solutions, custom tailored for their unique needs, leading to happy employees, happier patients, and a thriving practice. On a quick side note, if you have any questions, feel free to throw them down in the chat. I know we have a Q&A box down below, so we'll be monitoring all that. So feel free to go ahead and throw any questions in there. Who is using a PEO? The unique thing about a PEO is it's been used across all sectors of business for many, many years now, and it's starting to creep into healthcare. What's really, really cool is it works for all facets of healthcare, whether you're an independent medical practice, a dental practice, urgent care and specialty clinics, hospice, long-term care facilities, ambulatory surgical centers, physical therapy centers, diagnostic testing facilities, pharmacies. If I haven't mentioned your specialty and you're wondering if you're a good fit, you probably are. Where do you see the impact of a PEO? Really, the biggest reason organizations join a PEO is to take advantage of enhanced employee benefits. The number one reason, roughly 93% of organizations that join a PEO to help reduce costs, primarily when it comes to healthcare benefits, dental, vision, short-term, long-term disability, access to a lot of these things that, you think Fortune 500 level benefits, but it's about bringing that to a small independent practice like yourself for a fraction of that cost, stabilizing costs. So administrative costs associated with payroll administration, benefits, training, compliance, the ability to have a team behind your team with these specialists when it comes to payroll and HR and having LMS built in, all of these things creating a positive workforce environment that, helps reduce turnover. It helps create a positive environment, which allows you to attract top tier talent, increasing employee engagement. And one of the key things, as someone who's worked in the clinical role myself, helping manage a practice, is there's a ton of administrative work that goes into payroll and training and keeping employees engaged, as well as the normal day-to-day tasks of managing a practice, making sure patient care is up to date, focusing on revenue cycle and claims. So statistics show that organizations that join a PEO are able to roughly cut down on 15 hours of monthly administrative tasks just by offloading it to a PEO. All of this stability and scalability allows organizations to optimize revenue growth. When should you seek out a PEO? Thinking about the time, it being early October, where we're seeing a lot of renewals come in for small group premiums and health benefits, a story comes to mind. We actually had an organization recently reach out to Stitch, where they had just received their renewals for 2 health plans that they were offering to roughly 50 employees. Their first set of renewals came back for that first health plan at roughly a 25% increase. Unfortunately, the second healthcare premium health benefit that they were offering, which had a higher engagement level and enrollment level, came back with roughly 45% increases. When we look at this stuff, it's just not feasible to continue to pay this level of increase on top of, tacking in reduced reimbursements, the struggles with denials, the increased cost of operations. And so, the discussion for them came down to 2 kind of critical factors here. It's these increased costs now put them in a tough situation. Do they, reduce the level of benefits they're offering? Do they lower their contribution? The downside of such factors are, you start to make unhappy employees. You start with unhappy employees, you have, this revolving door. You start to get burnout and fatigue, and then employees are leaving. With these lack of proper benefits, you have a difficulty attracting talent. And when you have a difficulty attracting talent, now you have your current employees handling 2, 3, 4 different roles. And these administrators are now spending endless time trying to hire, going through interviews, trying to find the right candidate. And if you do bring on the right candidate, there's a cost to training them. All this stuff kind of creates this cycle of, unfortunately, a lack of stability, and it stalls out, and it starts to not only affect your revenue as an organization, but it also affects the key thing we're here for in healthcare, which is patient care, care delivery. And so if you're someone that has just received your renewals and those costs seem exponentially high, it's a perfect time to reach out to a PEO. If you're looking for overall cost savings, whether it comes to offloading some tasks, where HR is in need, or you need to potentially lower costs with workers' compensation. If you're dealing with high employee turnover overall, if you can't find the right talent and you need job descriptions, salary benchmarking, some support. If you're looking for support because HR and payroll is just too time consuming and you have enough tasks when you're focusing on your day-to-day practice life, you might be the right candidate for a PEO today. Why use a PEO? There's really three key statistics. The first one I did touch upon earlier, which is 93% of organizations that join a PEO to access a larger employee pool leverage for better buying power. What does that mean? When you are banding and creating a community of independent healthcare practices, you're now able to take this economy of scale and get better rates for premiums on healthcare benefits. You're able to get better support when it comes to HR and payroll at a fraction of the cost as you would when you're by yourself. Think 5 versus 500 employees. That's really where this PEO comes into play. 88%. 88% of organizations decrease their payroll and HR tasks without increasing their headcount. That's where a PEO comes in handy. You have a team of specialized payroll administration, you have HR specialists, business development specialists at your need designated to you for a fraction of the cost of what it would take to go hire each one of these employees. If you're in this mode of growth, 7 to 9% faster growth for organizations using a PEO as compared to organizations not on a PEO. So just as a quick recap, why use a PEO? Number one, cost efficiency, streamlined HR operations, improved employee benefits, having better benefits at better rates to attract better talent, having compliance expertise, helping with risk mitigation and workers' comp administration, all of that to help improve patient care. A quick little poll. You'll see a poll questionnaire pop up. And the question is, what is the biggest challenge your practice faces regarding your workforce? A, burnout. B, staff turnover. C, salary and compensation issues. D, benefits packages. Or E, vacant roles, inability to attract new talent. I'll give you all a few moments to go ahead and answer these questions.
It looks like folks are answering now. Roughly half the folks on have answered. If everybody else can make their selection. Give another 20 seconds or so. Okay, it looks like we've got the final there.
Perfect. Do we have an idea? I can't see the results on my side. Do we
Can't see it. Yes, let me, sorry about that. So it looks like the top two are burnout and benefits packages. Those are tied for number one, and tied for number two are staff turnover and salary and compensation issues.
Okay, burnout and benefits packages being the number one is unfortunately the biggest reality and the most common theme kind of across the industry, across the nation, right? These benefits costs, especially where I am in California right now, are skyrocketing, right? And I don't think this 40%, 30% increase in premiums is a surprise to anybody. And this burnout, it's really all entangled within the same thing, right? As an independent practice within this small to mid-market business where you have maybe 10 to 200 employees, which is the sweet spot for a PEO, you're really struggling to get the right benefits and attract the right talent. And when you do, you get this burnout because people just don't see this employee satisfaction. They don't see this HR culture that's built for them because it just costs so much for an organization. And a lot of times they end up leaving to these larger corporations where there is this structure. And so that's been a key focus, especially at Stitch, while we focus on healthcare, it's to provide this HR support and this access to benefits to these independent practices to allow you to look like a Fortune 500 level company without having to pay that major premium. Reducing costs. So we talked about this a little bit, right? Reducing costs. The key way we reduce costs as a PEO is by establishing this community by banding independent practices together. We create this economy of scale, and there's that key statistic we talked about. You'll probably see it many more times when Jason's speaking, as I speak. It is one of the biggest things for a PEO is 93% of PEO users are using a PEO for reduced cost. One of the biggest reasons we see, clients that have joined Stitch now when they reflect back is the cost savings that were delivered on benefits. We have organizations that we've talked to where 50 employees, we helped cut down costs by $65,000 annually from the employer side. Overall cost savings of 80, 90,000 across 40, 50 employees. Even groups that have 10 employees, they're able to cut down $10,000, $15,000 on benefits costs alone. And this stuff goes a long way over the course of a year. 40% higher expected annual revenue growth when using a PEO versus organizations that are not on a PEO. This comes back to that stability and scalability. The fastest way to grow is by having a stable foundation that fosters growth. We talked about benefits, and I know a lot of you talked about the increasing costs of benefits. It's not just about having this larger pool that allows you to have cheaper premiums. What's unique about a PEO is it's not a cookie cutter model in healthcare. We know that one practice in dermatology is not the same as the next practice in gynecology or in urology. And really where it comes to play is we sit down with each client. A PEO will sit down and say, hey, let's look at the needs of your employees. Let's look at your needs as an organization, what you're willing to contribute, how much you can afford to pay. And let's start to create something where we're balancing costs versus plan richness. Maybe you can't offer benefits just yet, and you want to be able to attract the right level of talent. We have alternative offerings. It's about dental, vision, being able to offer unlimited primary care. That's a concierge service for $20 a month. Maybe it's concierge services, prescription savings, discount programs. So it's what works to, attract the right talent for you, but also what doesn't gouge into your revenue as an organization. And so that key statistic there is organizations on a PEO come to a PEO because they're noticing 20% or more savings on benefits within their first year. Workers' compensation. A PEO allows you access to these master plans on workers' compensation. But what's also key is the administration of this workers' compensation, handling of claims, making sure that if there is a claim, those employees get the care they need and they're back to work as soon as possible. So making sure that workers' compensation is managed efficiently. Fractional certified expertise, the team behind your team. We've talked about this before, but this is a cost that, doesn't show up on your books because you may not be able to go hire these people, but you don't realize that you really do need them. Having an entire team dedicated to payroll and payroll administration, having certified HR leaders. If there's ever a labor law question or if there's an issue in your office, just picking up the phone and calling a certified, SPHR leader, just like Jason, who you'll hear from in a little bit, and saying, hey, Jason, this is an issue we're going through in our practice. How do we go through this? And having that individual sit down with you and say, you know what, let's formulate a game plan. This is how we're going to address these individuals. This is how we're going to address the situation. Make sure we're documenting this. Let's make sure we're staying fully compliant the way we maneuver PTO policies, which are, it's a big thing in California. Having a business and client success team that's there to help you foster your growth, make sure your business risks are taken care of. Just seeing where a PEO can help you and support you, having a benefits team, not just on day one to give you a set of plans and then set up some renewals, but continually look at where the market is taking us. Maybe we have some new innovation in healthcare or in the benefits, and actually telling you about these things and helping you cut costs regularly and improve employee satisfaction, doing employee surveys to help find what keeps your retention strong. If there are any questions about this stuff, this is the end of my time. Feel free to drop them below. I know we'll have a Q&A towards the end. Thank you very, very much for your time. I'm going to pass it off to Jason Ursoff.
Thanks, Hamza. I appreciate it. I always love presenting on webinars because it kind of limits my space in which I can talk. So basically, the frame of view is over from here to here. When I'm presenting in front of larger groups, I usually walk to my right and my far left. So this kind of keeps me in one little frame. But I want to begin by saying that our focus on independent medical practices is near and dear to me. I've been working in the PEO space actually since October of 2004. So this month is actually my marks my 20-year anniversary. And my wife is a licensed medical sonographer, and she's been practicing for approximately the same amount of time, just a little bit less. And she's worked for both large hospital systems and smaller independent radiology groups. And she's always been happier in that independent space. The independent practices that she's worked for have always seemed much more to her like a family. So we talk shop an awful lot. And it'll bring us back to our presentation where, this is all about you guys, the independent medical practices, and how we're going to help as a PEO. It's going to help attract, engage, and retain. And those are the three words you're going to keep hearing over and over again, but attract, engage, and retain the best, most solid workforce you can have. So we'll start off. We'll kick things off by talking about time, and I know that time is something we all wish we had more of. You're running a medical practice, so your primary focus should obviously be on your patients, not administrative headaches. But here's the reality. So, and I know this for a fact, HR is a huge time sink. I'm an HR professional. I know for a fact that everything that I engage in takes time and effort and a lot of resources and a lot of research. So a recent study found that small to mid-sized businesses spend an average of 25% of time managing HR tasks. So if you think about it, that's a full day every week spent on things like payroll and the benefits, any kind of employee disputes, and I know they're out there, and compliance. So if that sounds familiar, you're not alone. And like I said, this month I'm celebrating 20 years of being in the human capital management industry, and I can attest that lack of time and resources are two of the largest burdens for small and mid-sized companies, pure and simple. So here's where a PEO will step in, and why so many healthcare practices are turning to them. Next slide, please. All right, now here's a fun fact. So 88% of businesses say they've decreased their payroll and their HR costs without increasing headcount by partnering with a PEO. And yes, I said that it's 88%, just like you see on your screen. Payroll isn't just about cutting checks. So you've got to think about really all that encompasses. You've got the taxes, you've got benefit contributions, overtime calculations. And of course, in the medical world, there's, complex scenarios involving part-time, per diem, contract staffing. Outsourcing payroll isn't just about cutting costs. It's about eliminating the errors and the need for constant oversight. There was a recent Deloitte survey that showed that 49% of businesses say that they've experienced payroll errors at least once in the last year. And that can cost you employees. Obviously, people don't want errors or mistakes on their payroll. Obviously, money is important to them. So these errors obviously can result in hefty fines, unhappy employees, and obviously time-consuming corrections. So a PEO prevents this from happening by ensuring seamless, error-free payroll. That's the first main purpose. We can take over the payroll entirely, and we're there to ensure that's accurate, compliant, and always handled on time. So in the medical world, payroll complexities go beyond just those wages. A lot of practices out there have physicians on different compensation models, including productivity bonuses, RVU-based compensation, profit sharing models. So handling these complexities manually can easily lead to mistakes, missed payments, compliance risks, you name it. A PEO understands these complexities and obviously is there to automate the process for you. So in essence, a PEO will remove all the guesswork ultimately, and therefore freeing up time for your admin team and your payroll provider person. So remember that 88% stat I just mentioned. By offloading payroll and HR administration, businesses have reduced costs and saved a significant amount of time without adding to their headcount. So I'm sure most of you are thinking, what can we do with that extra time? PEOs provide access to advanced payroll software and expert teams that handle everything from managing those complex deductions to ensuring compliance with local taxes and tax laws. So you'll also get detailed reports. This will help you if you have to report back to your accountant or CPA. This way, you know exactly where your money is going without having to sort through spreadsheets. Next slide. So this is my favorite part, and it's offloading the HR tasks. So let's talk about those smaller day-to-day tasks that sneak up on you. Background checks, handling employee disputes, managing PTO requests, putting together a PTO policy. They're all necessary, and every single one of them is very time consuming. And this is something a PEO handles on your behalf. So medical practices, especially the smaller ones, they don't always have a full-time HR expert on staff. With a PEO, you don't need one. We talked, Hamza referenced fractional HR earlier when he spoke about services that PEOs provide. So whenever a tricky HR question comes up, whether it's about state labor laws, about compensation, or even how to conduct an investigation, the PEO's HR experts are just a phone call away or an email away. Or quite simply, honestly, I take texts too. So this can save you hours of research. I mean, that it reduces your liability and ensures that you're making decisions that are compliant and effective. So let's dig into some of the specific HR tasks that you can offload to a PEO, and I've listed some in the matrix here. One that often flies under the radar but eats up a significant amount of time is conflict resolution and mediation. When disputes arise, and they will, whether it's an issue of scheduling conflicts, compensation concerns, or personal grievances, these can drain the time and emotional bandwidth of the admin staff and the leadership team. A PEO can offer professional HR mediation services to resolve conflicts quickly with minimal disruption. And the PEO HR professional can take time to actively listen to each side and present solutions. It reminds me of a situation I worked with last year with a large senior facility out of California. There were two care providers that were complaining to the administration about their supervisor having a very rough tone with them and not treating them with respect and almost in a way bullying. They felt bullied. So the resolution was quite simple. I took time to listen to both of them independently and actively listen to what they had to say. And I went back, spoke to the administration, and they went ahead and allowed me to speak with the supervisor, and was able to give him some coaching techniques on how to properly work with your direct reports and how, active listening and proactive management can help. Ultimately, I was able to de-escalate a situation that could have been a lot worse, because they had even made mention of harassment, bordering on harassment. So these are the types of areas where having a PEO and having that HR person on staff at a PEO can really, really help you. Once again, it was close to 45 minutes each that I took to listen to both of to the two caregiver sides. So definitely an investment in time. So and then obviously complaints are not the only HR arrow in a PEO's quiver. So you've got to think about all the resources necessary to compose a compliant employee handbook, keeping it updated, and HR professionals on the PEO staff are there to assist with handbook creation and compliance, as well as providing other compliance on company policies. I always say that we don't create compliance; we work with you and guide you in kind of formulating that proper policy. So to go forward. So this will take a lot of the guesswork from the what can we do or what can't we do scenarios. Now, think of all the other things you currently handle: documentation requests, background checks, every other HR fire that comes up, and a PEO takes those tasks off your plate. Obviously, none of you wake up excited to handle a state unemployment dispute. Well, I actually don't either, but I still handle them, and those are my job. That's my job. So let the PEO manage that for you. Next slide, please. So let's now talk tech. Outside of the robust payroll and HRIS systems the PEO uses, applicant tracking systems, or ATS, it's a total game changer. So with the right technology, you can speed up your hiring processes by leaps and bounds, and you're getting access to a state-of-the-art software that handles everything from posting the job openings to tracking your candidates all in one place. So that eliminates the juggling between different platforms or sorting through a bunch of resumes. You've basically got the automation working for you. And here's where the magic happens for medical practices. Instead of having to post jobs manually to multiple platforms, or sort through those unqualified resumes, the ATS automatically filters the applications based on the criteria that you preset in the system. So that means you'll spend less time sorting and more time interviewing the top tier candidates that you're looking for. Additionally, a PEO's technology can coordinate interviews by sending out emails for scheduling to the applicants. It can track the interview feedback and even store credentials and licenses, which obviously is critical in healthcare. And so, you got to ask yourself, how much time would that save you? So ultimately, with the PEO's ATS, you not only post the jobs to multiple platforms at once, but you can also track the candidates through their hiring process in real time, which ultimately eliminates the paper trails or those lost resumes. We were working with a mid-sized dermatology practice that was dealing with an influx of resumes for an open medical assistant position that they had. And they were telling me that they manually reviewed close to well, they said around 200, 225 applications for each job posting. And that would take them days and often led to burnout for their on-site HR manager. And after implementing our ATS, they cut the process down to, in total, about 3 hours because the system auto-filtered and short-listed the top candidates based on qualifications and experience. Next slide, please. So now they've got some time on your side, let's talk about something just as important, and that's to keep your employees happy. We always say that employees are the practice's most valuable asset, and you know as well as I do that happy employees equal happy patients. So happy, engaged employees lead to better patient outcomes, higher retention rates, and a more positive practice environment. We go back to what I said earlier as far as my wife working in the independent radiology centers. She liked it because it had a family feel. There was a culture to it. When you work for larger hospital systems, you kind of lose a little bit of that personal family feel. So keeping employees happy is easier said than done. The demands of the healthcare industry can be intense, and if you don't have the right support in place, you'll see that the employee satisfaction, you'll see it suffer. And a PEO helps with this from beginning to end, from start to finish. It's more than just a service provider. You're partnering in creating a better workplace ultimately, and a better culture. So how can we help you along that entire employee life cycle? Next slide. So first we look at the hiring and onboarding. The employee life cycle begins with hiring, and let's be real, recruiting in the healthcare field isn't easy. Credentialing alone can take weeks. Now, a PEO can help speed up the process dramatically, and that will ensure that your new hires are vetted, credentialed, ready to start treating patients in no time, record time. And we talked earlier about how a PEO can assist with recruitment, but let's explore how this specifically improves employee satisfaction. So think about the staff when they're hired on. When you have an efficient and professional hiring process, it makes a really good first impression on the new hires. They feel as though they're part of, as Hamza mentioned before, a Fortune 500 company, a much bigger organization. So a well-structured onboarding program, complete with credentialing and the training, and obviously introductions to your practice's culture, sets that great tone for an employee's entire tenure there. And a PEO can handle everything from drafting job descriptions that attract top tier talent to conducting background checks and, most importantly, credentialing. Now, credentialing a physician or nurse practitioner can take anywhere from I don't know, a month to 3 months, 30 to 90 days, depending on the state. And a PEO ensures that this process is completed quickly and efficiently. That way, the new practitioners can start working sooner. And after all, the onboarding process, especially in the healthcare world, is about more than just showing new hires where to clock in and clock out. I had mentioned earlier about job descriptions. That's another place where a PEO can help you shine. You want to make your job descriptions for practitioners and your administrative staff alike stand out among all the other, in the job boards. So that's definitely something I've used to make a particular applicant drawn to a practice. Next slide, please. So now you've got the right team in place. How do you keep them engaged and growing? A PEO offers structured training and development programs that are closely aligned with what what your practice needs, whether it's ensuring compliance with mandatory healthcare certifications or offering leadership training for staff. A PEO helps you keep employees at the top of their game. And here's the kicker: 94% of employees said they'd stay longer at a company that invests in their professional development. Why stay if it's not going to lead to a longer path? So in a fast-paced environment such as an independent practice, having that easy access to on-demand training will improve employee confidence and satisfaction. It'll make them feel supported in their professional development. And then there was a Gallup poll stating that 76% of employees say that opportunities for growth are a top driver of engagement. A PEO's focus on continuous development ensures that the staff feels valued and equipped to excel in their roles. And when it's time for employees to move on, okay, it's hire to retire, as we always see it. A PEO ensures that the exit is smooth and compliant. No drama, no headaches, just a clean break. So, for an example, there was a dermatology practice that I work with that struggled with high turnover rates and morale issues. And after implementing our retention training program, their employee satisfaction, increased significantly. And how do I know this? The practice's turnover rate dropped by 25% in just over 6 months. So in this case, what we did is we sent out employee surveys to the entire staff. And what that does is it makes the employees feel valued and heard. And that's a very big thing. Active listening in human resources is always a very big thing. And based on the feedback that we received, we worked with the leadership to offer greater incentives to the employees. We were able to change some of the policies that they offered, so that they were less rigid. And we also worked with the practice owners and administrators to make some positive changes to the PTO plan, as well as offering or introducing a 401k program. And we also added some employee perks. So it's crazy just how a few changes can lead to such powerful results, and it shows. Next slide, please. So finally, let's talk about compliance. If you're in healthcare, the regulatory landscape is constantly shifting, whether it's HIPAA or OSHA, ERISA, the ACA. Staying on top of all these regulations can feel like running on a treadmill that's constantly speeding up. The healthcare industry is a legal minefield, literally, and staying compliant can feel like a full-time job in itself. So one misstep can obviously cost your practice, and compliance is one of the biggest risks for medical practices. One mistake could lead to costly fines and legal action, and a PEO helps mitigate that risk by ensuring that you're always compliant with the latest regulations. Next step, please. Next slide. So the healthcare industry, as I just said, is heavily regulated. So whether it's maintaining patient privacy under HIPAA or ensuring workplace safety under OSHA, there's always something you need to be compliant with. And a PEO is there to stay ahead of regulatory changes for you, ensuring that your practice is up to date with federal, state, and local laws. And this isn't just about avoiding those fines. It's about protecting your reputation and, most importantly, your patients. And then regarding documentation and policy, we've all been there. You're last minute scrambling to update policies or find an old employee handbook. With a PEO, your documentation is always up to date. It's maintained and stored in the system, and PEOs handle everything from, as I mentioned, the employee handbook books to workplace safety policies. So that way it alleviates that burden from your shoulders. And then regarding workers' compensation, EPLI, we all know that accidents happen. And when they do, having workers' compensation insurance that's properly managed can make all the difference. Managing the claims, returning to work status for employees that have been injured, managing all that whole entire process can be strenuous and time consuming. So a PEO will not only manage your workers' compensation program, but will also handle those claims and ensure that the employees are taken care of and that your liability is ultimately minimized. Additionally, I mentioned EPLI, which is Employment Practices Liability Insurance. What that does is it actually protects your practice from claims of discrimination, wrongful termination, other employment-related issues I deal with far too often. A PEO ensures you have the right coverage and helps you avoid these issues altogether by providing HR training and legal support. So these are the areas particularly where PEOs shine, mitigating your risk and making sure that you're covered. And then I also want to touch really quickly on tax filing and benefits compliance. PEOs also manage tax filing and benefits compliance. We mentioned healthcare laws like ERISA and the ACA are complex. Keeping track of the employee benefits and the retirement plans, the tax obligations, overwhelming, but PEOs ensure that you're in full compliance with these laws, and that will prevent you from costly penalties or audits. And so in conclusion, I just want to recap. Partnering with a PEO helps your practice in three key areas that we've mentioned. So it saves you time by taking over the HR task and giving you access to that top tier tech. It enhances the employee satisfaction through you've got your streamlined hiring, your training and retention efforts. Remember, attract, engage, retain. And then it ensures compliance and mitigates risk. So you can focus on patient care rather than paperwork. And with that, I'll go ahead and hand things back over to Hamza, our salesperson extraordinaire, to tell you more about how our PEO services can transform your practice. So Hamza, it's all you.
Thank you, Jason.
Of course.
Quick little conclusion. I'm sure many of you know about the Stark Law. Here at Stitch, we have our own little Stark acronym. It stands for stabilizing costs. It's the key takeaways, right? It's the key core principles of APEO. So stabilizing costs, transferring of risk with a PEO, helping with that risk mitigation, attracting and retaining talent, reducing administrative burden, and then the final one, K, keeping your practice compliant. I know we have some time for some Q&As, so I will turn it over to our moderators that are monitoring the questions.
Great. There are some questions that came in. Let me ask the first one here. What stops my practice from negotiating these health benefits premiums myself?
Hamza, do you want?
Sure. Yeah, I'll jump in. So the unique thing that we've talked about, right, about a PEO is that community of independent practices. So, you can go and try to negotiate rates, but what we tend to see is when you have, 10, 15, even 100 employees, and you go and say, hey, I want to get these discounts that I see other larger groups are getting or these PEOs are getting, you're going as a one person, as this sole sort of individual or entity. When you're banded together with all these community in this community of independent practices with the PEO, it's not just 50 or 60 employees. Now there's hundreds, thousands of employees all pooled together. And now we're going on your behalf and saying, hey, we have, 2,000 healthcare workers that deserve the right to better rates on premiums. And we have this economy of scale. We want to help them take advantage of this. If it's not you, it's going to be another health plan. And so that helps us get this leverage and bring the maximum benefit to you as a practice.
Great. Here is another one that has come in. What differentiates Stitch from other PEOs like TriNet or Insperity?
Okay, I can take that one. So as I said, I've been in the PEO space for 2 decades as I'm aging myself right now. I've worked for a number of different PEOs, and I can easily say that this PEO with Stitch, the fact that we focus on one particular industry allows us to be ultimately a lot more efficient. And what I mean by that is, for example, let's talk about the employees that work for Stitch. We all come from some level of a healthcare background, including, and it starts at the top of their CEO, having been in the healthcare industry for many, many years, actually even owning, having some ownership in some medical practices in the past. So we have that knowledge, and we also have very specific resources that we've, using that knowledge, we've gone and vetted lots of vendors that provide us different applications, different resources that are specific to the independent medical practice. Another thing too is even something with workers' compensation. When we are trying to bring on a new client, we only deal with a handful of workers' compensation class codes, traditionally revolving around the healthcare practice. And a traditional PEO, they cast a very large net. So basically, healthcare practices are also pulled in, as Hamza alluded, referenced, with roofers and construction companies. So, the good thing is we stay within the medical community and we're not pulled in with some more hazardous job types that could cause higher prices in the workers' compensation field.
Great. There are a couple more. Let's see if we can get to at
Sure.
least one of these. Let's see. How does a PEO help improve employee retention, specifically for healthcare professionals? Is it
Okay.
mostly about offering better benefits, or are there any other factors?
Okay. So the answer to that is yes to all the above. So the way I see it, and this is something I deal with day in and day out, because it is about the I mentioned earlier in my part of the presentation, attract, engage, or retain. It's not about just bringing on a great workforce, but it's also keeping them engaged. It's also maintaining them as employees for the long term. So, with it's very we take a very customized approach. Every practice, every client of ours, every practice is different. Some are smaller than others. I just got off the phone a little bit earlier speaking with an 8 employee podiatry group. And their needs are going to be a little bit different than the needs of a much larger, I mentioned this earlier, a senior living facility. So, you know, every we take a very customized approach to each and every practice, each and every client of ours, and we kind of find out exactly what does drive that engagement with the employees. Where are their where are what I like to refer to as power, they're actually the points of power in their culture. Where is it that the employees are seem to find a lot of happiness with? So one of the first things that I like to do is send out an employee survey and sent out on our behalf, sent out to our clients to kind of get a feel for, hey, let's see where the employees are at right now. How do they feel about where they're working? Is it someplace that they see themselves 3 years to 5 years from now, or is it just hey, I'm here while I'm in school and then I'm going to be moving on to the next place? So you've got to kind of find out and do that active listening to find out exactly what the employees are looking for. And then it's basically kind of in a way that mediation, talking to the employers, the physician owners, the practice administrators, and bringing to the table, hey, this is what the employees are looking for. This is what will ultimately make them very happy and satisfied. Can we kind of put the bridge and make that? Can we institute a new policy? Can we add this particular new benefit or addition to PTO hours or some other little incentive, just to make sure that we maintain a thriving atmosphere within that company's culture?
Great, Jason. There's a few more questions in here.
Sure.
The first one is for me as the moderator. Just a quick question. Somebody missed the beginning. Yes, you will be receiving an email with the recording as well as the slide deck. So that one's very easy. Here is another one. How do you help with employee reviews? Do you have forms and templates?
Yes, great question. We do have a large resource library of templates for everything from reviews to, wow, I mean, you name it, we have it. It's even performance improvement plans. We constantly update our library and we allow our clients access to that library. We, on top of that, we also have what's called performance management. We actually have a tool, a resource that our clients can use to track and provide those performance reviews on a, well, however, whatever whatever the if it's a semi-annual or annual performance review, we actually have a system that they can utilize that will keep the template of the review. We can add multiple different templates, so it's really the interface is very user friendly for both the person that's giving the review, the supervisor, as well as the employee, him or herself as well. So yeah.
Great, thank you for that. We have time for a couple more. Here is one. Do you currently have a master policy for your medical plan offering?
Hamza, I'll take a break. Do you want
Okay.
to?
Yeah, so we're actually working on finalizing a few of our master policies with a few health carriers. We have a few unique relationships, one of which, being Redesign Health, our parent company, and one of our supporters and investors, having a lot of support backed by CVS Health, Samsung Health, and General Catalyst. And so having those resources to go and actually talk to these organizations. And while we don't have that master policy in place yet, we still have that economy of scale and those relationships built where we've been able to secure still 20, 30, 40, 50% cost reductions on these premiums on a regular basis for a lot of our clients.
Great, thank you. I think we have time for one more, if you guys are up for it here.
Sure.
Okay, in terms of compliance, how does a PEO ensure that my practice stays up to date with changing healthcare regulations like HIPAA or new state laws?
Okay, great question, and I'm going to reference those tools and resources that we own, or that we have, I should say, internally, that we use. We have a powerful tool that we have that actually informs me from me being in the HR department, of different changes in compliance, regulatory laws. We always like to stay up to date on reviewing those. We are, as a matter of fact, even the tool I use to help create handbooks, that has an update component to it. So anytime there is some sort of regulatory change or a policy change, state law, local law, federal law, it'll actually notify me, so we can actually keep those handbooks up to speed. It'll change the way that any of the verbiage that needs to be changed, it'll reference that. So that's just one example. But we like to stay up to date with we work in many states, so states are one thing that can always be a given. It's compliance. It's always moving. It's a moving target because there are always so many changes in the regulatory environment. So we just have to make sure that we stay on top of that, and we use the tools that we have internally to make sure we can do so.
Great. Actually, one more just came in. Let's see. It is, you mentioned that a PEO can help automate payroll and HR processes. How quickly can a medical practice expect to see those time-saving benefits after partnering with a PEO?
Well, I'd have to say probably close to immediately. I mean, for example, we have a client of ours, a relatively larger client of ours, that saw some significant time savings just on their payroll processing side alone. We were able to, with the introduction of our time and attendance system, there were less, it was less of a manual process where supervisors would have to go in and speak to the payroll manager and the payroll administrator, and have to make corrections on the payroll. So I would say, right from the get-go, right, almost from the very first payroll, in some circumstances, you'll see some degree of change, and sometimes that can actually it can amount to a decent amount of time savings for the employer. But in terms of just even with the employee satisfaction levels and retention levels, I would definitely say, give us at least 6 to 8 months we first have to kind of get a feel for where we're, what we're heading into, what the state of the organization is at the time when we're going in. Send out those employee surveys, find out where they are, and then try to make those kind of course corrections. Work with the ownership of the practice and making those course corrections. So yeah, I'd say within a year or less, we can make some huge improvements.
And if you don't mind me chiming in just a bit, I mean, there's one of those statistics we talked about a little earlier. If you're looking for an ROI perspective, one of the major statistics for a PEO is that 27.2% ROI within the first year. From a workflow perspective, it's almost immediate, right? As soon as that first payroll is run, you're not responsible for having to manually track these time reporting, schedules, even the schedule management part of it. You have a fully integrated schedule management where you're not having to now have whiteboards and text schedules and all that stuff. So from day one, it becomes a faster workflow. And then all of this extra burden of having to release the payments and actually track things is off your plate.
And one last thing on top of that, because you just made me think about it, Hamza, with our time and attendance system, one of our groups that we have, we were able to eliminate time theft. So basically, employees clocking in greater than 15 minutes earlier from their schedules, or clocking out 15 minutes later, we're able to actually set and automate the process, where there's the time and attendance system will not allow the employees to clock in any sooner than the number of minutes that you specify. So that in itself is a time saving right there. Time theft is huge in the workplace.
Great. I think that's about all we have time for today. So thank you everyone for joining us. We really appreciate your time and attention. We hope you found the content informative and valuable. And as I mentioned earlier, we will follow up with a link to the webinar recording, as well as the slides, that you can share those with your colleagues as an additional resource. Thank you so much to our partner Stitch, and in particular to Hazma and Jason for taking time today to share your expertise. We appreciate it. Thank you, everybody. Have a good day.
Thank you.
Thank you.